I'm going to pause. We'll talk about safety plan next, but I just want to, again, when we're asking about harm to infant, we talked last week, but just a bit of a reminder of the anxious thoughts, the fear of something terrible happening to baby. But it's very what we call ego dystonic. It feels like this is not me. I would never act on these thoughts. I feel awful about having them, but they're just sort of intrusive ruminations. That's a much lower risk situation. A higher risk would be psychotic thoughts, any kind of command hallucinations, or sort of religious delusions about needing to harm baby or children. Any history. So when it comes to harm to baby, history of impulsivity or aggression, history of being abused, I would say, whoops, I did that. More so if it's unprocessed. So I think a lot of moms have history of being abused that I work with, and it does not correlate to them being more likely to abuse their baby or child. But we do know that there can be intergenerational patterns of abuse that can be present, especially if somebody hasn't acknowledged the pain that caused them and are just sort of more caught in that cycle of replicating the abuse. But I want to be careful about that one because I work with a lot of women who have history of being abused and are very, very thoughtful about their parenting and wanting to break that cycle and not wanting to repeat the abuse within their own parenting relationship.